So welcome to our fourth series for our UGA College of Public Health Black Alumni Connection seminar series. I'm Kim Metcalf, and I have my bachelor's in environmental health science and my master's in environmental health science from UGA College of Public Health. And I am proud to say and honored to be the vice president of our new College of Public Health Alumni Board. As we all know, public health transcends all of the planet, the socioeconomic status. It's just everywhere, and we're all lucky to be able to participate in this area. So for us, diversity and inclusion is the core of the work we do to ensure health equity for all. So for those of you who are new to our group, we started out just over about a year ago as an alumni working group for the College of Public Health to put a foundation in place to have a board of directors for the alumni of the College of Public Health. So we started out with a mission that I'm going to read to you all. Our mission as the College of Public Health Alumni Working Group is to unite a network of dedicated alumni to create programming and engagement opportunities for our community of alumni, students, and faculty to connect and show their commitment to the UGA College of Public Health. So it's exciting to say that we've moved and transferred from being a working group to now, as of this fall, we're an actual board. A lot of our board members are on today, so I'll just let them introduce themselves, and I'll start out with our president, Miss Erica Parks.
Good evening, everyone. I'm happy that you all here. I am Erica Parks. I am a single dog, not a double dog like many of you all are. I graduated in 2011. My focus is in health policy and management. I am happy to have you all here, and I hope you all will come back and continue to spread the word. Share, share, share. We want to see more of you all here, and we want to see some repeats.
All right, Adam, you want to go next?
Yes, sorry, my dogs were going kind of crazy. Adam Gobin, double dog. What did I do? Pre-med biology, Spanish, graduated in 2006 and then graduated in 2008 from the College of Public Health. And just really excited. I'm on the alumni board, so super excited about that and all the opportunities given me, including being able to monitor the chat box for Miss Nichole over here. It's going to be exciting. And I'm super pumped for today's presentation. So nice to meet you all.
All right, Adam, if you want to just kick it to somebody. Let's see.
Lanisha.
Hello, everybody.
Can y'all hear me, everyone? Okay.
We hear you.
Okay.
We can.
Oh, okay. Hi, my name is Kanisha. Sorry if you hear things in the background. I wanted to be outside today, but I'm Kanisha. I am a double dog as well. Did biology and psychology for undergrad, and then I actually did a double master's at the College of Public Health. So I did health promotion and behavior, then I also did social work, and I finished in 2019, so pretty recent. I'm happy to be here.
Thank you. We're glad you're here. How about you, Meredith? You want to go next? You're on mute, Meredith.
You see me now and you can hear me. Good.
Mm-hmm.
Having technical difficulties. Awesome. Well, Meredith Woodman, I graduated bachelor's in 1996. And I'm the executive secretary for the College of Public Health Alumni Board. Very happy to be here and looking forward to the session. Thanks so much. All right.
All right. Lori, you want to go next?
Hi, sure. My full face. Lori Elmore. I graduated in 2000 from UGA back when it was with my bachelor's degree in health promotion and behavior back when it was the program was in the College of Education. So this is my this is our first year on the board, but I was a part of the inaugural working group. So it's nice to virtually meet some of you who I do not know. I'm going to kick it off to Reagan.
Hi, everyone. I'm Reagan Tuff, and I'm a member of the working group. I'm a graduate of the College of Public Health. I came out in 2009 with a PhD in health promotion and behavior, and it is a pleasure to be here for this presentation.
All right, and then Lanisha, you want to go?
Okay. Hi, everybody. I'm Lanisha Scott. I graduated. I just looked it up. It was the College of Agriculture with a bachelor's in environmental health sciences back in 1991. And I am currently a board member on the board for the College of Public Health. Yay. Glad to see you guys.
Well, we're glad to have everyone here. So just to remind you all, this is the 4th of our series, and we've had some great speakers, and we're excited to have Nichole here today. We wanted to put something in place to give us a foundation and to have a good programming in place for our graduates, our students. We've had a lot of different participants on this, different alumni, not even from the College of Public Health have jumped in on these. So we've been really greatly pleased with where we are, but we're doing this series because we're commemorating the 60th anniversary of the desegregation of the University of Georgia. And we wanted to make sure that we as the College of Public Health were honoring some of our alumni that are the change makers of color in the public health field. So that leads us to Nichole, and we are just so glad that you come to be with us, and we appreciate you being on a Zoom platform. We were all hoping that COVID would be better and we could all be together in a room, but we're going to just make it work. So I'm going to read to y'all a little bit of her bio because she has done so much in the 20 years since she has left the University of Georgia. I got tired just reading to see what all she's been up to. But Nicole Hancock graduated from the University of Georgia in 1998 with a bachelor's degree in health promotion and behavior with a focus in corporate and community program planning. In 2003, Nichole earned her master's degree in education with a concentration on instructional and curriculum design and training from American Intercontinental University. She has over 20 years experience working in a variety of sectors, developing community-based health education programs. We're thrilled to listen as she reflects back on her 20-year career. She's worked for Emory Winship Cancer Institute to Maximus, which is a healthcare consulting company. And she's been doing some nonprofit things too that we're going to start out with. So Nichole, we're glad you're here with us today. If you want to just say a few words to get going, and then we'll just jump on into some questions.
Well, welcome, and I'm glad to be here. When Erica reached out to me, I was tickled pink. I have to say, no pun intended. I do love the color pink as my nonprofit is Shades of Pink. But I was just excited because I had no idea that there were so few of us that graduated within the College of Public Health in the time span that I've been gone. So since graduating, and it's quite an honor because I think together, all of us on this call, on this Zoom meeting, could probably solve the COVID crisis right now. We've got so many ideas. I'm sure every time you hear something like me, you think, oh my God, public health, what are y'all doing? We can solve this so much easier than what's going on. So they really need to employ all of us, as far as I'm concerned, in coming up with a plan, because I'm sure that everything that we learned in our 4 years or 8 years or 10 or 12, whether you've gotten a PhD, applies to this particular pandemic and this situation. I've worked in women's health, AIDS, teen health, cancer, like she said, like Kim mentioned, I've done quite a bit at the federal level within Emory, and then I moved into healthcare consulting. And I have to be honest, I kind of follow the money. But working for a university, you know, there's a ceiling. But I was handpicked from each position that I was in to end up where I ended, which was at the healthcare consulting company called Maximus. And I love that. I worked for all 150. I was in charge of all 159 counties within the state of Georgia's Medicaid managed care program. And all of that went from university, well, corporate actually, because I worked for Coke for a little while. And I decided corporate was not for me. And that's how I ended up in the university setting. And then I went from university to Winship Cancer Institute into healthcare consulting. So this has been fun. And through all of that, I started a nonprofit. And I think we'll talk a little bit about my nonprofit work as we go along. But This has been a roller coaster ride. I'm medically retired right now due to some health issues I had after a severe ankle injury, and it's just gone from there. But I've maintained being in, and when people call on me for consulting work, and I continue to lend a voice because I like to talk, which is why I decided not to become a physician, Adam. I started out bio pre-med as well, but I decided I like to talk and educate people. And the 15 minutes in the room is not going to get it for what we need to talk about oftentimes. So I decided to ditch that effort and got in a little bit of heat with public health when my parents were like, what is that? What are you doing? What kind of job will you get? Because in the 90s, of course, all anybody knew was CDC. They didn't know anything else about public health. You said public health, and they was like, what? You're going to be a nurse? You know, every job back then was nursing. Health educators were nurses. And so breaking in was kind of difficult to try to understand that I wanted to eat the peas on the plate that they didn't want and go out into the community and educate people about various topics, depending on what it is. You know, we work in silos. You know, subject matter experts on various things. We're never totally all things, a jack of all trades. We tend to be focused on environment or education or training or, you know, AIDS or diabetes. You tend to get focused. So I ended up in women's health, which is what I really liked. And then I got into breast cancer. And that's kind of where I've been for a while.
Well, that's perfect. That leads us right into the first question that we've got. And, you know, I think if we can't find speakers for later on in the year, we should have you back already because you've got so much to say and so many amazing things to talk about. But as I was saying, we try to tie our series into an event, a month or a day or something around the time period where we are. And on September the 29th is actually National Women's Fitness and Health Day. And that leads us right into Breast Cancer Awareness Month in October. So looking at different studies since 1990, we've seen a 40% decrease in mortality rates for breast cancer survivors because of doing our mammograms. So I'll say our call to action today is on September the 29th. Let's all schedule our mammograms, and I'll refer to this again later and have everyone in our network. Let's remind everyone to get that done.
Yeah.
Because 3 or 4 women who are diagnosed with breast cancer often don't have any family history of that or any kind of health risk. So it sometimes comes as a surprise. So that leads me into the question, and you alluded to it with your nonprofits. So tell us a little bit more about your Shades of Pink Breast Cancer Survivor Choir. You gave us a little preview before we got on the official call. So tell everybody about how did that come about, and how did what are you still doing with that now, and when do you perform next?
This particular idea came about. I was the first. Let me back up and say I was the first person hired on Governor Barnes's cancer initiative back in 2000. So he hired a doctor by the name of Dr. Jonathan Simons to take over Winship. And at the time, Winship Cancer Institute was probably 2 floors over at Emory. And they wanted to expand it because what we found was that the patients, because there was not a center of excellence within the state of Georgia, people were driving to University of Alabama, Birmingham, UAB, because they were a cancer center of excellence. Even though if they wanted that top-notch treatment, that's where they were going. And we were losing our patients to Alabama. So Governor Barnes decided, hey, let's try to see what we can do. We've got institutions here. We've got Emory, we've got Tech, all within, let's just call it a 50-mile radius. That can actually hone in on becoming a center of excellence. So what they decided was they would have a center of excellence would be at Grady Memorial Hospital. And that was because there was a target population, of course, but that they would also work because Emory serves Grady, they would do it, it was in conjunction. And that center of excellence, after it got through, after we talked it through, it turned out that the center of excellence needed to be at Emory. So they ended up constructing the Winship Cancer Institute on Emory's campus, which I was involved in that as well, the design and some of that, but also the design of the 9th floor at Grady Memorial Hospital, which is the Avon Breast Center, because Avon had given some $36 million to Emory to when they were doing the 3-day walk. So that's how they were raising money to Emory to start a community program and have a floor dedicated with a gold elevator and everything that's still there, the 9th floor of Grady, to pretty much revamp all of that, because at the time, the underserved population and those that were diagnosed were actually just huddled up in a room with maybe 10 chairs for chemo. And it was quite sad. And Avon said, no, we want to do more. We want to use the monies that we raised here in Atlanta when they were doing the 3-day to actually impact those residents that are here. And so that's how all of that got started. And I was one of the first people brought on to try to develop a community outreach program that could reach any and everybody within, at the time, it was the 10 metro counties. And I didn't know much about breast cancer. That wasn't my focus. I'd come out of working with women's health and HIV/AIDS with Federal Region 4 through Emory's Regional Training Center. And so I had to do a lot of learning on the job, but and a lot of community outreach. But at the end of the day, decided that we would do a community health advocacy program, and did a lot of work with that, and finally got about 200 ladies to sit for training that I had designed and developed. We trained those ladies, and most of them just happened to be breast cancer survivors. They wanted to spread the word and educate their neighbors and their communities and their church congregations. And out of that, I realized that we didn't have a lot of ladies that wanted to, African American women, that actually would go to, what am I trying to say, sessions, support groups. They didn't want to go. They wouldn't go. They weren't interested in sharing their information and their stories and reliving it. And that was very different than our Caucasian women, who were heavily dependent on support groups. And African American women were faith and music and their pastor and all of their congregations to support them. So said, what do we do here? How do we reach these ladies to be able to educate them beyond going to a support group? And decided that music was an avenue that I could use to, one, educate, but also do testimonials and survivorship and hope, as opposed to, I don't want to say support groups are doomsday, but there's always someone new coming in with another sad story. So it's hard for people to progress out of a state of being a victim into a state of survivorship and thriving. So I wanted to do something positive. And so that's how this came about, and partnered with radio stations and had to find choir directors and musicians and all of that. But it became therapeutic for these ladies, because in order to join, you had to write your testimony within a very small box. And we had, working with a researcher, the box was probably about 6 by 4 on a piece of paper. Tell me about yourself and tell me about your story. And what we found was no one could fit their story in that box. But that was the first step in healing. I'd get these 5 and 6 page documents, this is my story. And my husband had a stroke the day I found out that I was diagnosed, and I came home and he was on the sofa, and I had to delay my treatment. It was just one thing after the other. But many of these ladies had never discussed any part of their journey, because they didn't go to support groups. So that was the only way you could join, was to I had to break the ice with them. I wasn't a survivor, and I'm not, but that was the only way I could connect, was to understand who each one of them was at the time and what they went through. These ladies then became a group of 100 voices. We had a full band, and we put on our first concert probably a year later, after they, because what the support group was actually rehearsals. So every rehearsal, it was just, all I needed you to do was meet one new person, make one new friend. That was the goal. So somebody you could talk to for anything, because family gets bogged down as caregivers, and we knew that. And they didn't always want to share anything with a husband, a spouse, a child, that maybe they had a scare or maybe they had a scan. And they didn't want to weigh that down, that information back onto their family. So to find a buddy within the choir, and the music became therapeutic. These ladies could not get through rehearsal without tears and tears and tears and tears. And until we realized, once they stopped crying, we knew that they were okay, because many of them had gone 20 years, 10 years. Some were still going through chemo when they joined. And that was my overall goal, was how can I impact the community of women? And you didn't have to be African American. It was just you had to be a breast cancer survivor. That was it. Of any age, of any stage. You could have been DCIS, that was fine, all the way to stage 4 metastatic. It didn't matter. We just wanted you to participate with us. And we did all of that. Had our first concert. We sold out Peachtree Presbyterian with 700 people in a 2-hour concert. We would later follow that with travel across the country to California. We performed with Babyface and Shaka Khan and Joss Stone, and we did background for, several high profile performers. Julio, we did the New York Stock Exchange Christmas, which was televised. We did Frosted Pink, which is now Stand Up to Cancer. It started out as Frosted Pink. But these ladies had an opportunity to travel to DC and California and Florida, all expenses paid. And many of them had never been outside of the South, which was interesting. And some had never been on a plane. So the experiences were vast. And they had a sisterhood that was amazing to be a part of. It's not something you want to join, but if you had to join something, they were happy to be a part of this. And we would then do a performance at Symphony Hall. Had a huge concert for 1,700 at Symphony Hall with Vicki Winans as our guest performer, and they did background for her. And so being a part and just getting to be behind the scenes, we've done probably 6 or 7 Atlanta Falcons halftime shows for their breast cancer game, that their crucial catch. We do the national anthem for that several years. These ladies, like I said, have been all over. It's been great. The sad part about all of it, though, is that we lose quite a few, and we've lost quite a few. I think over the past 15 or 16 years, we've probably lost 35 ladies, 2 of which died this past week. So it's kind of a tough thing, but it's a reality. Is even though people are diagnosed many, many years ago, they may have a new diagnosis, some other type of cancer, but through it all, we all try to support them. But that is the tough part of being in that arena, is that there is a possibility of death. I mean, with any part of life there is, but being such a close knit. So out of the 100, about 30 of those have died. So it's kind of gets your heart each time. Yeah. But those ladies are, the ladies are happy. They're there. They're a much smaller group now, probably about 20 of them. It just over time, over the 15 years, there were some people that just couldn't handle. Like I said, out of 100, about 35 have passed on. And then there have been some that have come back. It's just kind of transitional, but it's easier to manage with 20, 25 people.
I bet it is.
Because trying to bus and fly 100 or pick people that could go was really taxing. But it's one of my prized things that I've enjoyed doing. And through all of that, I was mentioning I've had some awards from the Atlanta Braves and the Falcons and the Center for Black Women's Wellness and a host of other things. But that's probably my prized possession. I really, 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 really enjoyed that. And like I said, I caught a little heat for it from my bosses. I said, trust me, music, faith, women of color, it's a testimony, it's hope, it's positive, and it's something that we can definitely take. And Avon actually paid for the ladies to have choir robes. So they had legit choir robes in burgundy and pink. So they were always outfitted, and that people knew who they were when they arrived because they had these choir robes that had Avon Foundation on the, on the cuff. And it's a gorgeous sight. I'll have to find their signature picture, but and
we would love that.
And
if
send
you
it
could
to
share
you.
that with us.
It's
It's
great. It's great.
I love that you were able to see that sometimes you have to meet people where they are and figure out how to meet them in their space instead of trying to force them to conform to the traditional methods. To be that innovative, that's great. We can talk about that all day. I know we've got some other questions we need to get to, but that story was just fabulous, and I appreciate you sharing that. That's amazing. And do we have anything in the chat box before I go on to another question?
Not yet, but I had a question. Can I do a self chat box?
Yeah, jump on in.
So I was going to ask Nicole, how do you, there's the sad component that you were talking about. How do you personally deal with that? Because that's tough.
Yeah, it's really tough. I will say that they're just as much of a support to me as I guess I was to them and am to them. But it is some of the ladies they were more like, the older ones became more like grandparents to my daughter, who was 2 at the time.
Jeez.
And some of them became more like my aunties, So it was so much of a family unit. Yeah. So I had grandmothers, I had, sisters. We had some people that were 25, 26 when they were diagnosed. Some that had been 30-year survivors, but it is definitely taxing. I did have to take a step back for a while because I had to kind of breathe. It had become a lot to deal with because each time that someone passes, we literally would perform, sing at their funerals and bury their robes with them. So you get up to 30 and 3 and 4 a year or 5, and it was hard because I'd have to present and utilize those people on behalf of the organization, and the choir would have to sing. They wouldn't have to sing, but we were obligated, we felt, to recognize that family, and the families usually would always want us. If they didn't, then that was fine. We would honor them with a plaque or something, but we didn't get off that easy all the time. Yeah. But it was tough, and that being in that world of, I will say, cancer is one of those where it's not pretty. I mean, to make you laugh, let's break this up. I've seen more tattooed boobs lately. In my time, I'm serious. They're really proud when they get them. They're like, got a whole new set. Got a tummy tuck. There is comedy in it because some women take it as this is the new me.
Right.
And you have to embrace the new me as the new normal for them. And if that's what makes you excited, hey, I'm all for it, Right. And it lightens the load. So some would decide not to have any reconstruction done, and some would decide I'm going big or go home. And and there's a step process to it, and some would have tummy tucks and some would move fat from other areas. So it was unique to see how what they decided to do with their healing and how they wanted to be their next part of their journey. So it could get comical. I will say that, Adam.
No, thank you for that. You made the comment about, you were joking about the provider pre-med piece in the beginning, but
yes.
At your 30% death rate, you're seeing more deaths than an actual physician on average. And that's why I asked, your mental health, because my Lord, it's crazy. Anyway.
Well, and I'll also tell you, one of the places that we rehearsed just had one of the ladies, her husband just happened to own a funeral home. He was a pastor. They had a church, they had a funeral home, and we rehearsed at their funeral home once we left another location. And it was interesting. My daughter was probably about 4, and she would Miss Osi would literally walk the kids over to the mortuary, and they'd go see Miss Jones and Mr. John. So death for my daughter is very easy. So it's kind of, she grew up kind of seeing people. So she's like, when's the next funeral? I'm like, please don't be the lady that ends up in the back of every funeral home, that's praying for everybody that's passed in the neighborhood. But she's grown up with it. So it's as we look at death, she doesn't see it quite the same way.
Right.
And if you grow up with it, I guess it's kind of different. People that work in the mortuary business and the funeral home business, it's just another part of life. But when you get to know people, it still stops you, still grabs your heart, still catches your breath, takes your breath away. That wasn't the reason I didn't become a physician, although my daughter is going to become a physician. So, she's going to take the reins from me. I tried to get her into public health. She's like, no, don't like people that much. So complete opposite of me. They told her people need to be dead or asleep. And so that works for her as a surgeon. So.
I love it. Well, we've got a question in the chat. We've got a question from Reagan, and it's a twofold question.
Okay.
The first part's a smiley face. Second part is a legit question. So Nichole, are you a singer? And then do you know if the choir has been replicated for men, and were the results of the choir approach published?
Kind of, sort of shower singer, maybe in the car. I mean, I can hold a tune. I don't, we're going to keep that one quiet. As far as men are concerned, there was a project down in Albany, a guy by the name of Daryl Sabbs was trying to start one years ago, and it has not, to my knowledge, been replicated with male breast cancer survivors. There have been some people that have tried to do it just as a choir that celebrates a specific disease process. I haven't seen it completely replicated. We had, bless you, my dog sneezed, I'm sorry. We had a lady that did do some study on research on the choir. It wasn't for that matter though. It was more so on the support side of it. I don't think it has all these years later. A choir seems easy, but a choir is really hard. I picked kind of like one of the hardest things to manage, because you got a lot of personalities within a choir, lots of different personalities, and with that, comes the management of people. And if you're not interested in managing a lot of people with a lot of personalities, then music is good, but you still got to manage the people. So good luck with the male choir. I think it would be great. We tried to get a couple of men, and they just didn't want to be with so many women. They were like, I'm at home with my wife already and my kids. That's no. I'll speak. They wanted to speak, but they didn't want to sing. So
Good deal. Well, totally to completely change gears.
Okay.
Let me go with our question that we try to ask all of our speakers. How has being a Black professional shaped your career? Can you speak to us about that?
Okay, well, I was often the only in the room. I'm sure that that's not unique to anyone. I was looked to probably because of the population that I was serving, when I worked specifically, we'll talk with Winship Cancer Institute, and I can actually talk about my work with Maximus, was typically an underserved, disadvantaged population. You think Medicaid, you think lower socioeconomic status, you think terrible mortality rates and screening rates, you think African-American women, late stage diagnosis. So I was kind of a good face. I was a brown face because you want people to look like you when you're speaking, trying to deliver a message, such as you need to have your mammogram, or when's the last time you've done X, Y, Z, and when is the last time you've done this for your child. It tends to be received differently, as we all know, and what we know about public health, if that person looks like you. So I was often, like I said, the only one in the room or around the table when it came to being a project manager or a director or some of the other roles that I was in at the upper echelon. But when it came to dealing with the people, the masses, it was probably a positive because I was looked to as a subject matter expert once we got further down the road, when I dealt with women and communities and cancer. And that's how I transitioned out of breast cancer. I was kind of plucked out of that role and into running the state's Medicaid managed care program for all 159 counties, because they wanted to take what I'd done at Emory and apply it across the entire state with community health advocates and patient navigators and reaching those people. So it's been a positive. But I've never been one to, going to UGA kind of helped straddle both sides of the fence. And that's very important for many of us. And I always encourage kids, my family went to HBCUs and they were very shocked when I chose UGA. To the point where I got are you really kidding me? Because my godmother's mother was the dean of Spelman in the 70s. So, and my mother had gone to Spelman, and my uncles and grandparents had gone to Hampton University. So when I didn't choose, I was the first in the family to veer off of that path. And they just couldn't understand it. And I said, bear with me. The whole world is not Black. I get what you're saying. I understand it. I appreciate the legacy. But I was interested. I didn't graduate a high school that was predominantly Black either. So I was quite comfortable with being around any race of people. And I think that it helped when you step out in the public health arena, you've got to be able to mix with all kinds of people. And, you can be one-sided and be this, but at the end of the day, you have to be able to communicate to any and everyone, regardless of race, in delivering a message. That's why I said together, we could probably solve the COVID problem. The marketing problem, the booster problem, it's poor messaging, because it's just poor messaging. And I could sit for days from January of last year and solve this with 2 strikes. Mm-hmm. It's not that hard, but when you don't know, you don't know. But we all know, and we've got the background, know how to reach numerous crowds of people, regardless of what their belief is.
So it's not in the chat box, but when are you running for governor again?
Let me see. Never. The potty mouth won't get me alone. That UGA thing, right?
Oh yeah.
Well, that leads us into the next question that I had is how, as a Black alumni, do you look at engagement as an alum, specifically a Black alum, with the university and specifically with the College of Public Health?
I am actually open to, I love mentoring. I had a lot of kids from Spelman when I was working with Emory Winship on this huge project. I mentored several girls from Spelman who actually thought they wanted to be all kinds of things. And I said, girl, that's not, you don't need to do that. You need to do this. And they're very successful now. But I like mentoring kids because I think that if they're exposed to enough opportunity, we tend to focus on one thing because we think public health is just working for the CDC or is just working in a healthcare system. And we don't realize that there's so many titles that encompass what you can do with a public health degree. You just have to kind of figure out what your specialty is, but it takes some tiptoeing. You may have to take a job working for the American Cancer Society or Families First, or take a job at Home Depot in their corporate wellness department for you to realize that you don't like corporate wellness. That was me with Coke. I realized Coke isn't interested in keeping their employees healthy. They had everything that you could ever desire, but they have very low participation. They provide the tennis shoes, the socks, the hairspray, the shower gel, the clothes to go work out, all the space, all the activities. But Coke is trying to sell Coke, and they're trying to market Coke, and their people in their departments, communications departments, and commercials and everything, they're not taking time for that. They may go on a rafting trip, but are they showing up at your mommy and me? No, they weren't. So they have them, and they have their doctor's offices on site, but and same thing with Home Depot. It's corporate. It's an avenue to try, and some people are very successful at it. I didn't care for it and quickly moved out of it into the university setting, which I loved, working for Federal Region 4 and doing trainings and developing. It's kind of in the event planning world when I first started out, but it was still in that realm of teen pregnancy, and then it moved into women's health, and then I worked in AIDS, and I decided I didn't like teen health because I wasn't interested in being a teacher to young people. I like training adults. I like dealing with adults, and that's kind of how I ended up in this. But I like dealing with the 19 to 20 plus because they have an understanding of what they want to do. They just don't always know how to do it. And that's where I think I could be beneficial in just kind of opening those avenues to maybe understanding that there's more to public health than just the CDC avenue, which is what most people think of. And it's a great job. It's a great job, but there's so many more ways you can impact community besides the CDC.
So have you signed up for the new UGA mentorship program?
I think I just got somebody's email today.
Excellent. I would love to see you in that program. Adam and I both participate, and I'm sure there are other people that are participating on this board that I just can't think of off the top of my head. But I'm telling you, I agree with you. Our field is so vast, and there are so many opportunities, and I think people don't understand that. And I think when they can peel back those layers and see all of the different avenues that public health has to offer, you need to be in that mentorship program, and
I'd love to.
And let our College of Public Health students listen to you and get some of this knowledge. Because again, I mean, I hate we're running out of time, and we haven't really even touched on all of your career, which has been amazing. Yeah, we're down to just 10 minutes left. Is there anything you want to talk about, or Adam, are we missing anything in the chat box real quick before we kind of start closing down?
No, nothing in the chat box yet, but I did want to ask Nichole on the or not ask, but I just think you have such a good perspective of public health. I love that you say it's not just a CDC job, because I really do think people think that. I graduated from the program, and I started being convinced of the same thing, and going into hospital and healthcare systems. I worked at Emory just like you did, and when I talk to my mentees, it blows them away. They're like, I'm an epidemiology student. I presented just like Lindsay said last Friday, and I had all these epi students messaging me saying, holy crap, like I didn't even think personalities of leadership and being a manager and things like that would be something I could get a career in. So healthcare business, and I think you'd be phenomenal in the mentor program because you'll blow minds. Really, you'd blow minds into people because when you're a student, you're so tunnel vision. You think, I'm in pre-med, I'm going to be a doctor, but you don't know there's healthcare administration. There's all these things if you don't like blood like me, but so I really think you'd blow minds. And just everything you said today, I hate that I know I was supposed to monitor the chat box, but I am the chat box, but you've been blowing my mind and just like, how are you handling your mental health? I have all kinds of questions, but thank you so much. I just wanted to say, I'm probably not doing my job. Hang on, we're getting some chat. Hang on 1 second, let me do my job. People are saying, heck yes, could you be my mentor? I'm working on my PhD, and a mentor is always needed because some paths really aren't explored. And I think everybody's echoing the things that you're saying, and how valuable it is. So.
Well, I mean, I just think I kind of bounced around. Like I said, I was cherry picked for each one of my jobs, even coming out of Georgia. Mark Wilson at the time referred me to a certain job, and then I ended up from that job into another job. And it was one of those things where I could have taken more pay, but I said, no, I think I'm going to take this little entry level position here because I was committed to I didn't want to get a public health degree and then be working in retail or accounting or do something that I kind of figured that I needed to do what I needed, but I had to explore those avenues because like you said, Adam, you don't know. It was at the time, corporate wellness was really big in 1998.
Yeah.
And Coke and Home Depot were really big on their, they were the leaders here in Atlanta. So Coach Jim Donnan wrote my letter of recommendation for Coca-Cola. So I was a Georgia girl.
So Nichole, we've got Meredith also saying that I would like to see Nichole as part of our Take Action Tuesday because of the things that you've enlightened us with. Also shares that Mark Wilson is was her mentor at UGA as well. And also you'd get our vote as governor.
Oh.
So we have 2 people already signed up to vote for you.
Maybe.
Yeah, that's me. It's Meredith. I was trying to do my video. I'm just going to talk, but Nichole, you're awesome. Thank you for your service. First of all, I experienced not to the level that you did of loss, but when I worked at CDC for all the years I did, we lost people in HIV and AIDS, so I can understand how that is. But just a big hug to you because all the stuff you've done, you didn't have to, and I know you've impacted many generations and many families that way. So thank you for your service. And yeah, secondly, I know when we had our retreat back a month ago, we were talking about how do we take action? What do we need to do? And how do we have more of a presence, not only at school, but what can we do? And I would like to just throw it out there, especially coming up, as you said, Kim, with breast cancer awareness. If there's a way, I mean, I know you're busy, Nichole, but if there's a way we can continue to have that conversation, and I know that one of our board members had talked about doing, lecturing, even if it's via Zoom, to some of our classes, I think that would be amazing. Because to your point, Adam, everybody, when they hear the excitement, the passion that we all have, Nichole has, it inspires the younger generation. That's what we want. We want people that can articulate and make actionable steps to help our public health. So just thank you for all you've done, and think about this not being your only opportunity to talk to us. I want to make sure we can reach out to you again. And yes, you have my vote for governor.
Thank you. I will be held hostage for about 3 months when I have my shoulder surgery, so you can call on me. I will literally be home sitting again. So
bless your heart. Thank you.
But it's just a shoulder. I'll survive. I just won't be able to move. So I'd be like, hey, luckily it's not my left hand, it's my right. So I can still, give y'all a high five. So.
Well, Nichole, this has been amazing, and I think we could keep zooming for another hour at least. Because I had a whole list of other questions. And we didn't get close to them. No, this has been fantastic, and this is what we're hoping to do. I mean, the energy level that we're feeling from each other, and the excitement of hearing the path that you've had through the College of Public Health and mentoring and all these great things coming together are just fantastic. So thank you so much for your time. And
let me know what I can do. Let me know what
we're going to be emailing you about the mentorship program for sure. So you can go ahead and get yourself signed up for that.
Okay.
Because that is definitely something that I know I get selected a lot from the College of Public Health, because there are not a lot of us that are from CPH in that mentorship program. They've got like 2,000 mentors.
Oh, wow.
And not a lot of them are for College Public Health. So we need everybody in there.
Agreed.
But yeah, just a couple of closeout things just to kind of wrap us up. Remember our call to action, September the 29th, is going to be Women's Health and Fitness Day. So, schedule your mammogram, Adam, reach out to the ladies in your life, get them to schedule their mammograms.
Breast cancer too, Adam.
Yes, ma'am.
I have a brother-in-law that's a 2-time breast cancer survivor.
Yeah.
No, great point. Great point. Very true.
Yeah.
My 22-year-old son will probably kill me, but he's going for a scan next week because he has something strange under his nipple. And he was like, it can't be breast cancer. I'm like, absolutely, it can be breast cancer. So if everybody can be praying for us,
Right.
we would appreciate it. It would be very unusual for someone that age to have that as a male, but nonetheless, it's there and it's odd. So September 29th, everybody do that. We'll have details on our next seminar in October coming out soon. So y'all can get all kinds of updates on our publichealth.uga.edu website. Flu shots, I know we're all still like in the COVID realm of the world, but this Thursday, if you're local in Athens over at the Health Science Complex, they're going to have flu shots available from 1 to 3. So if that is something you are interested in and you're in town, come on by. I'm going to be running over there to get mine for sure, because I've had COVID and I've had the flu.
Oh, no.
I don't want either one again. And then the last thing I had was just our State of the Public Health Conference on October the 14th. That's something that the University of Georgia does. You can register for that, and it's a Zoom, so we can all be safe and stay in our Zoom world for that. But registration's open for that, and you can get the details again on the college website. So Nichole, thank you. And thank you all for participating, all our board members and our guests. And Nichole, if you just want to close us out with any last couple words, we'd appreciate it.
Someone asked about mentoring, doing a PhD. I don't know who that was. But, that
was me.
That was you. No, just call me. I'm easy to reach. Text me first, because I'm one of those people like, I don't know that number. I don't want to be rude, but text me first, and I'll be glad to do whatever I can. I actually am helping another young lady who's doing her work in Tibetan medicine. So,
thank you so much.
But if you need anything, I'd be glad to, do whatever I can to help, or you get stuck, just call me. I'm kind of a good unsticker. So when it comes to writing and things like that. But yeah, just let me know. Other than that, I'll sign up to be a mentor. Look forward to working with you, ladies and gentlemen. And let's get more people in the College of Public Health excited about doing other things around here.
Amen.
So there's a lot of work to be done. I do a lot of armchair quarterbacking for public health.
There's a lot of chatter, Nichole, just saying thank you so much for obviously learning more about you and being able to connect. And obviously folks want to continue the connection. So Lindsay will help to connect you and those folks. So thank you.
Go Dogs.
I love it.
Go Dogs.
Go Dogs.
Thank you.
Right.
Thank you, Nicole.
Thank you all. I appreciate everybody participating, and we'll see y'all in October.
All right, have a great night.
Bye.
Bye,
y'all.
Thank you.
Bye.
See ya.